Hi, I'm Dr. Arter, a family physician with 10 years of experience treating lower back pain. Of the top 5 types of lower back pain, muscular imbalance is the cause in 90% of all cases. If you have these symptoms, you probably have muscular type lower back pain. Is your pain located in your lower back in these locations? Does your pain get worse when you stand or sit for long periods of time? The longer you sit or stand, the more it hurts. And then do you shift your weight side to side to relieve your pain? Does laying down or slouching temporarily reduce your pain? Do you have pain first thing in the morning? Does stretching your back and getting massages feels good, however only temporarily? Do you have pain almost every day, but occasionally more severe pain lasting 2 weeks where it's hard to bend over and tie your shoes? If you had imaging on your back, MRIs or X-rays, they are likely normal or show degenerative disc disease or bulging discs. If you have most of these symptoms, keep listening. I'll explain what caused you to have this condition, how to treat it, and how to prevent it from coming back. Now, if you have any of these symptoms or risk factors, go see your primary care provider right away. If your pain is located here, these are the locations of other less common types of back pain, not discussed in this episode. For legal purposes, see your provider to confirm these recommendations are right for you. You might be asking how I know you have muscular imbalance back pain. Muscles fatigue over time, just like if you did bicep curls. Eventually, you'll get tired and your bicep will hurt if you keep curling your bicep. Only resting your bicep muscle will feel better. Your lower back muscles, in contrast, can only rest when you're not upright. I'm sure you've noticed that laying down temporarily improves your pain. This is because you're resting your tired back muscles. Just like your bicep muscles during curls, your lower back will get more and more painful the longer you use it. When you bend side to side, you're trying to find another muscle such as your abdomen or your obliques that aren't tired yet. This type of back pain, which worsens the more you use the muscles and relieves upon rest, is a feature of muscular type back pain, and how we can rule out other types of back pain which hurt immediately and may not improve with rest. So what caused you to have this condition? Muscular type back pain is due to an imbalance between 3 large muscle groups: tight core muscles, weak lower back muscles, and tight hamstrings. How did you get this condition? In short, sitting causes all of these imbalances. If you have a sitting job for long enough, you will get back pain unless you actively try to prevent it. Human beings for millennia remained upright for most of the day, and our bodies have adapted to this lifestyle. Our ancestors spent the whole day upright, either hunting and gathering, and when they sat without back support on the ground or on logs. Chairs are a modern invention, as is office work, TV, and couches. When we sit in chairs, our lower back muscles rest and get weak. When we try to get up and stand, the weak back muscles are unable to bear the load. Our core muscles relax when we sit in a chair, shortening our body's attempt to adapt to the position we're normally in. However, when we stand, they become tight and fight the power of our lower back, further imbalancing our back. Our hamstrings, connected to our pelvis at the pubic ramus, pull on our pelvis. Because the pelvis is connected to the spine at the sacroiliac joint, our spine is rotated into spinal flexion. The result is excessive spinal flexion, hip rotation, or what I call the gunslinger posture of chronic lower back pain. Let me demonstrate with an illustration. Now, this is a normal spine without back pain, let's say. In a person with no back pain, the lower back only has to do 10% of the work. The abdomen is going to do the other 10%. And the goal is to put most of the weight evenly balanced onto the spine. In a person with chronic muscular lower back pain, the lower back is very weak. And because people sit a lot, and because they have bad posture and tight hamstrings and a tight core, as a result, the abdomen will overpower the weak back. The abdomen will do no work to help. In fact, it will do negative 10% work. And the back, therefore, has to power against the abdomen. Will have to do 60% of the work to keep you upright. Now, the discs in the spine are no longer balanced evenly. Most of the weight, and I'll show a diagram here, is being bared on the edge of the spine, right here. The disc, because it's situated like this, is going to bulge at the back. This is called a bulging disc. Over a long period of time, this can lead to herniated disc, where the disc ruptures and fluid comes out. And so, as a result of the basically all the weight being bared here, it's not very efficient. What happens is that you can only bear about 50% of the weight when the spine is curved like this. So as you can see here, the lower back muscle has to do 6 times more work than it does in a person who does not have the imbalances and has better posture. Because what this means is that if you stand for 60 minutes and you don't have any back pain at all, in a normal person, if you had the imbalance on this side over here, you could only stand for 10 minutes before you start shifting your weight, trying to find muscles aren't tired, because you're going to tire out your back muscle much faster. What's worse, if you don't correct this position, again, so we can get a herniation of our disc. Herniated disc can lead to disc degeneration, which is a scar we mentioned. Not painful by itself, but it can lead to other problems like loss of disc height. And when we lose disc height, what happens is that the disc acts as a buffer and a shock absorber between the bones. And so if we don't have that, the bones will start to hit each other, and that can lead to arthritis of the spine. And you'll have other things like facet arthritis that will develop as a result. So many of the worst outcomes of long-term lower back pain that can develop over decades will happen if you leave this condition uncorrected. Though mechanical lower back pain is easily treated with corrected rehabilitation, left untreated, your back pain is progressive. Unequal spinal pressure due to spinal flexion will, over years to decades, lead to scar tissue on the disc called degenerative disc disease. However, this condition is not painful by itself because the spinal disc lack nerve fibers. Think of degenerative disc disease like having a scar on your discs. Scars don't cause pain, however, they are a sign of damage that was done in the past. More importantly, loss of fluid from the disc due to herniation can lead to desiccation, where the disc loses fluid like a tire losing air. This is the reason that people sometimes lose height as they age. This can lead to arthritis as bones not designed to bear weight begin to bear weight, such as at the facet joints. Over time, spinal arthritis, the body's defense mechanism to mechanical stress, can cause pinching of nerves due to bony growth. But don't worry, even in the late stages of back pain progression, which occur only after decades, even then, untreated muscle imbalance is often the main pain generator. Fixing the muscle imbalance will prevent progression and oftentimes greatly reduce pain. Now let's talk about how to treat it. We must correct the muscle imbalances so that your spine bears the weight evenly and efficiently. To do this, we must strengthen the lower back, stretch tight core muscles, and stretch the hamstrings. Let's talk about how to achieve muscle balance. The first exercise for strengthening your lower back is the quadruped arm and leg raise, as you can see from my model. As you perform this exercise, do 15 reps on each side and at least 3 sets, or until your back becomes slightly tender. Hold your leg and arm for 10 seconds with each repetition and contract your abdomen. Do this at least 3 times a day. This is a strengthening exercise. You must do these exercises until your back muscles are slightly sore. This will mean you have achieved enough muscle fatigue, which will lead to muscle growth. If this exercise is too difficult for you, try the lower back extension exercise. Contract your lower back until your arms and legs raise. Hold for as long as you can and repeat 15 more times until fatigued. Repeat for 3 sets of 3 times a day. For a more advanced exercise, weights can be used, such as with the barbell back extension. With good posture, bend forward until the weight is just past your knees. Then bring your back into full back extension while keeping the weight in front of your pelvis. Do not use heavy weights. Focus on more repetitions versus more weight. This exercise should not be painful. Repeat for 3 sets of 10 to 20 reps with 50 to 70% of your max tolerated weight. Now for your core. This is the back extension exercise. Start in a neutral flat position. Slowly do a push-up with your legs and pelvis flat on the ground. If you encounter sharp pain, do not go into full arm extension. Instead, rest on your elbows for the duration of the exercise. Stay in this position for 5 minutes before resting for 5 minutes on your stomach. Repeat 3 times, twice per day. Now for the third muscle imbalance, the hamstrings. It is important to warm up the hamstrings with exercises prior to stretching to improve results and avoid injuries, such as a few minutes of jumping jacks or running in place. Try to keep your back in good posture with a lumbar curvature as you reach for both toes. Keep your legs straight as you bend forward. You should feel a mild stretch in the back of your thighs and lower back. Hold this position for 30 seconds and repeat 10 times. You can do the standing hamstring stretch or the sitting hamstring stretch with similar results. Now keep in mind, you will notice no immediate difference in your pain until you have done these exercises every day for at least 3 weeks. We are trying to make big changes to large muscle groups that have gone out of position over years and which continue to go out of balance if you are sitting for 8 hours a day. Stretching the lower back or back massage may feel good immediately, however, do nothing to eliminate the muscular imbalances that cause your back pain. I have noticed that giving up after not achieving immediate results is the #1 reason that my patients do not improve. Additionally, chiropractic care can improve lower back pain, however, temporarily. Repositioning slipped bones, however, they will slip out again in hours to days until the imbalanced muscles pulling them out of alignment are corrected. After correcting your muscle imbalance, maintaining proper posture will become easier. Good posture will allow for 6 times less effort for your lower back and will allow you to stand much longer before your back muscles fatigue. Good posture allows your core muscles to help reduce the work that your lower back must do. Good posture reduces the risk for herniation, degenerative disc disease, and progressive back pain, and is the goal of your muscle exercises. Let's demonstrate good posture. Stand up. Rotate your chest. Imagine a balloon is attached to your chest, pulling you up by the string. At the same time, tighten your abdominal muscles. Squeeze your butt muscles as you push your pelvis slightly forward. Now grab and squeeze your abdomen. This should feel tight. Now grab and feel your lower back. This should feel loose. You want your abdomen to be engaged and your lower back to be loose, sharing the load and balancing your back. Don't be alarmed if it feels uncomfortable. It takes time for your body to adapt to correct posture. If you've seen little old ladies with their back hunched over, believe it or not, that position is the most comfortable position for them and results from years of uncorrected posture. Check your posture 100 times per day until you're in proper posture always. Sitting, standing, walking, running. The more you do it, the more natural it will become as your body adapts. You need to change your modern lifestyle to match what your body is designed to do. Stand as often as possible. When not possible, sit with good posture. And when you're tired and can't stand or sit with good posture, sit with lumbar support to avoid spinal flexion. Sitting is bad for our backs as it causes all 3 muscle imbalances. The best investment you'll ever make for your health is to stand more. Buy a stand-up desk for home and work. Stand with good posture instead of sitting as much as possible with a goal of 8 hours per day. Stand while you watch TV. Stand in meetings. A person who stands with good posture is a person without back pain. If your back gets tired from standing, sit in a chair that has no back support, such as a stool or an exercise ball chair. If you absolutely need a break from standing or sitting without support, you must use a rigid lumbar support, not a soft one. Scoot to the back of the chair with your butt, lean forward, and then put a water bottle or half a foam roller or other cylindrical device in the lumbar curvature of your back, and then lean back. This will support your lumbar curvature while you rest your back. Avoid spinal flexion at all costs. Keep a lumbar support in your car, even a large water bottle works. Built-in lumbar supports in cars and chairs are not effective because they're too shallow to work. If you have pain in the morning when you get out of bed, this is common. The heaviest part of your body, the torso, will sink into the mattress. As a result, your spine goes into spinal flexion all night long, resulting in all the abnormalities we discussed. We are not designed to sleep in beds, as they are a new invention in our history, and no matter how much money you have spent on your bed, they all have the same flaw: no lumbar support. Our spine is not straight, it has a lumbar curvature that must be supported while we sleep, or it will collapse. And when it does, your lower back muscles get stretched out and our discs bulge all night long. Nighttime spinal flexion will prevent proper healing of damaged spinal disc, as the discs fill with healing fluid while we sleep. This is why we are taller in the morning. A simple but effective solution for back and side sleepers is to put a pillow under your bed where the lumbar curvature of your back is. Lay down in bed, find the curve in your back, put a pillow underneath your mattress there. This will push up on your bed, which will push up on your lumbar curvature, providing nighttime lumbar support. Thanks for listening. I really hope you found something useful from this episode. Please let me know any questions you have in the comments. I couldn't talk about everything in this video because there's so much to say about chronic lower back pain. Please see attached educational printouts with a summary of recommendations in the comments area, as well as links to stand-up desk and exercise ball chairs. If you're interested in any other videos, please let me know in the comment section. I hope this video has helped you. If it did, please like and subscribe. If I get enough interest, there will be more content in the future.